Prevent bone softening. Osteoporosis is often called soft bones. Soft bones is when the bones become hollow and lose their hardness. It develops when more bone is broken down than replaced. The inside of a bone looks something like a honeycomb. With osteoporosis, the bone which forms the walls of the honeycomb gets smaller, and the spaces between the bone grow larger. And the outer shell of the bone also becomes thinner. Osteoporosis makes a person's bones weak and more susceptible to breaks. The long-term effects of osteoporosis include a progressive loss of bone density, resulting in a higher risk of broken bones or fractures, which cause pain, limitation in movement, and other possible effects. An estimated 10 million Americans aged 50 years and older have osteoporosis, and approximately 44 million others have low bone density, which may put them at increased risk. Most of these are women, approximately 2 million are men. Fractures can occur in any bone but occur more often in bones of the hip, vertebrae of the spine, and wrist. Usually, 1.5 million bone fractures occur due to osteoporosis in the United States every year, of which 700,000 are spine fractures, 300,000 are hip fractures, and 250,000 are wrist fractures. Sometimes even a strong sneeze or cough can cause a fracture in someone with very advanced osteoporosis. Bone are living tissues which have their own blood vessels and are made of various cells, proteins, minerals, and vitamins. This structure enables them to grow, transform, and repair themselves throughout life. Osteoporosis in adults is divided into two categories. 1. Primary osteoporosis. Primary osteoporosis makes up the vast majority of the cases. Many factors contribute to its severity, such as age, nutrition, and activity level. While it affects adults 50 years or older, it can also affect younger adults as well if their activity levels are not enough to stimulate bone growth activity. Postmenopausal women are susceptible to primary osteoporosis since osteoporosis is closely related to estrogen deficiency. During menopause, the drop of estrogen leads to more bone resorption than formation, resulting in osteoporosis. Apart from the fact that this problem exists in women, some men may also suffer from osteoporosis due to decreased testosterone levels. 2. Secondary osteoporosis. Secondary osteoporosis is similar to primary osteoporosis except that it occurs in response to a particular disease, usually one that will affect hormone levels in the body, such as conditions that interfere with thyroid health. It also affects those with chronic kidney disease. In general, the causes of osteoporosis can be categorized as follows. 1. Lack of physical activity and lack of exercise. This is because the muscles are weakened and cannot protect the body skeleton, so the bones bear a lot of weight and become weak. 2. Lack of minerals, especially calcium and magnesium. These substances form the structure of bones. This can especially affect pregnant and lactating women who experience calcium deficiency. It is very difficult to absorb calcium in the body, and some foods may disrupt its digestion and absorption so that calcium cannot be absorbed by the body. One of these substances is caffeine, which is present in coffee and other carbonated soft drinks, of a large amount of protein materials such as meat. Eating too much red meat may leach calcium from our bones. It's not surprising that the highest level of osteoporosis exists in countries where the consumption of meat, coffee, and carbonated drinks is high. 3. Lack of oxygen in the body and bad blood circulation. 4. Disturbance of the body's hormonal balance. This is because the absorption of calcium depends on many hormones, the most important of which is estrogen. During menopause, because the amount of this hormone decreases, the absorption of calcium also decreases. Long-term use of estrogen hormone also causes heart disease, breast cancer, and some other diseases, although you can use plant hormones instead. 5. Long-term use of some chemical drugs, such as corticosteroids, SSRIs, PPIs, anticonvulsants, antacids, blood thinners, blood pressure, anti-ulcer drugs, some blood sugar-lowering drugs, and others. 6. Cigarettes, alcohol, even chronic stress. Normal exercise is important, but excessive or intense exertion can have a negative effect because intense exertion over long periods can have a metabolic effect that leads to loss of bone mineral density. Diagnosis of osteoporosis. When the symptoms of this disease appear, it indicates that the bone is damaged and the disease may be fully advanced. Symptoms of vertebral fracture include severe back pain, loss of height, or spine malformations. Of course, X-rays and urine tests also show advanced osteoporosis. An accurate test that shows osteoporosis in the initial stage is bone densitometry. Usually, women should do this test at the beginning of menopause and repeat it every few years. An adult needs 1,500 to 1,200 milligrams of calcium per day, which must be taken through food or pills. The use of foods that are high in calcium, such as broccoli, seafood, fish, shrimp, oysters, milk, soybeans, turnips, beans, figs, and almonds, prevents osteoporosis. Exercise such as walking, running, tennis, etc. can be very effective, especially when started at a young age. Treatment. In modern medicine, some doctors prescribe estrogen hormones. One example is calcitonin, which is used to control the levels of calcium in the blood. But these drugs can have side effects, and in case of excessive consumption, these chemical drugs may cause breast cancer and heart disease. The natural method of calcium, magnesium and silica is very important to prevent and treat osteoporosis. And to absorb these substances, you should avoid eating foods that are acidic, such as tea and coffee. Calcium is found in leafy vegetables such as parsley, watercress, broccoli, sea moss, beans, legumes, grains such as barley, and dairy products. In addition, calcium is absorbed by the body when it is accompanied by a sufficient amount of vitamin D and magnesium. Fish, egg yolk, fish oil have vitamin D. Of course you know that the body makes vitamin D when exposed to sunlight. Magnesium makes calcium soluble and absorbable. Milk has a lot of calcium and vitamin D is usually added to it, but because it is low in magnesium, it is very difficult to absorb calcium. We hope you like our video. Please like and share with others, and thank you watching our video. Please like this video because liking it will make more people watch this video. Subscribe to the channel and activate the bell option to be the first to watch our videos.